Clicking the COVID-19 projections banner on healthdata.org gets you to our latest forecasts for the United States and the rest of the world. In the green bar there is a drop-down location menu. Click on the state or country you want to review. If you scroll down, you will find graphs detailing total deaths, daily infections and testing, hospital resource use, and social distancing for the location you selected. The hospital resource use numbers only apply to COVID-19 patients. Each graph has 3 dotted lines that represent different scenarios for the future trajectory of the COVID-19 outbreak. The color of each line corresponds to the name of the scenario above the graph. If you place the cursor over the information icon to the left of the scenario names, a drop-down window describes each scenario in more detail. You can select which scenarios to view by clicking on the X in each scenario's name to remove it, or add back using the drop-down menu. Each line represents our best estimate for what will happen in that scenario. If you place a cursor over the graph and move it left or right, a text box will show you the numbers for each day for our best estimate for each scenario, as well as the low and high range for that category. In the top right corner of some graphs, an icon provides access to select your own parameters for that graph. These include turning on the uncertainty setting, a coloured band around each dotted line that represents what we think are the low and high range for that category, since these are estimates. If you click on the Compare tab in the top left corner of each graph, you can select a second state for a side-by-side comparison, along with a projection for the entire United States as well. By moving the cursor over the dotted grey lines, you can add another state, or you can go to the setting icon in the top right corner and disable Show Other Locations. Don't forget, these numbers will be updated regularly, so please come back to see the latest projections. At the bottom of the page there are links that take you to IHME's COVID-19 Resources webpage and allow you to download the results or contact IHME. If you'd like to know more, there are links at the top of the page. Thank you for visiting. Come back soon.